This is the 12th video in Ethics and Legal Considerations for Animal Chiropractic. In this video and the remaining videos, I'm going to talk briefly about record keeping. Now, this again is something that you are probably already familiar with, and I'm not trying to reiterate that information, but hopefully giving you an opportunity to refresh or recall some of the advice. So as we talk about record keeping, I like to start by reminding us about the goals of record keeping. What are we trying to accomplish? I mean, certainly, I think the thing that comes to mind first for most healthcare professionals is we want to protect ourselves from litigation. And I think records provide a valuable role in preventing and protecting you from litigation. If records are kept well, they should accomplish that goal. But I think a more important reason for keeping records is patient care. Patients are going to be cared for by other doctors and other staff members. And when other doctors and staff members take over the care or intervene in the care of a patient, they need to know what's going on. It's also important in the continued care by the record keeper to help refresh your memory about this patient, what worked, this condition, how did the patient respond, helps you decide how you may need to modify the treatment plan, helps you decide how to provide the care. And if you have a practice that's very busy at all, it's simply not possible to remember everything that you've done with every patient and everything that way that a patient responded. Now, I think it's less important in the context of veterinary practice, but insurance claims is another reason for keeping good records. Insurance companies don't like to pay unless there's good records to support the services that were provided and the necessity for those services. So as far as the ownership of the records belongs to the doctor who creates them, the veterinarian in this case. Um, they own the record. Now, if copies are requested, they should release copies. Um, if a veterinarian or a chiropractor sells their practice, animal chiropractor sells their practice, they need to make arrangements for possession of the records after the sale of the practice. If they're not going to stay in the area, they need to make arrangements with somebody else to take possession of the records and to notify all the clients who will have possession of the records so that the clients can obtain the records if necessary. Records need to include patient progress notes. I think one of the most important records for your use, as well as to protect yourself from claims down the road, is an indication of how the patient is progressing. Now, obviously, with an animal practice, you don't get to ask the patient, how's your pain on a scale of 1 to 10? But what you can do is observe the patient, observe the way the patient moves, observe the way the patient responds to touch, and that can tell you a little bit about any pain or discomfort the patient is experiencing. Be careful about using things like dictated but not read. Medical doctors have used that phrase for years to try to excuse their typographical errors and mistakes in their records. And the truth is, it just makes you look like you're not very professional, especially in today's world where it's too easy to proofread, too easy to make sure that things are correct. And with the autocorrect that's available out there, you want to be sure that you have proofread things so that the right words are in the right places. Sign-in sheets are a good way to prove that a client and a patient were there in your practice on a particular day or a particular time. Um, Records should not be erased, should not use correction fluid, liquid paper, shouldn't use labels to cover up mistakes. If you make a mistake, you should correct it appropriately. Uh, you don't want to try to hide anything. You don't want to make it look like you're concealing anything. You want to make an appropriate correction on paper records. You want to make an appropriate correction with an audit trail on computerized records. Maintain your records in ink, not in pencil. Don't skip lines or leave spaces so that you can try to come in later and fill things in. Don't try to squeeze in notes. Don't indent. Again, you're not trying to leave blank spaces to fill in later. It's a good practice to just draw a line through those blank spaces. So if you finish a note and you've only used a quarter inch of the next line, just draw a simple line through the rest of the space so that you're not even tempted to try to fill it in later. So those are some good starting practices. We'll talk about some more in the next video.